What happens when I come off this medicine? So what, again, in your experience, is there an end in sight where you think, once they've reached their target weight, they can come off of it? And by you having a program for them, they can maintain, where they are, or are there problems?
Yeah, as I mentioned earlier, Dean, my patient, no one gets the medicine without having some skin in the game. So they need to show me that they can practice some form of restriction. Okay. So my patients most of them do the fasting. My patients do not gain that weight back. They take it off. If you look at the data on these medicine in general, patients mostly gain the weight back because they're not on a particular program. Of course, when they studies, they had them followed with dietitians, but no one follows caloric restriction for the long haul. So my patients need to demonstrate to me that they can do something with structure that will allow them to maintain the weight once it comes off. And my patients lose weight much more rapidly than patients, if you look at the studies, who just take the medicines because they're doing the medicine as an adjunct to the lifestyle being the mainstay. So in regards to access to the medicine, this is a big issue, and these medicines are extremely expensive. Not everyone has the insurance coverage, right? So there are now, there's, again, semaglutide, which has got Ozempic for diabetes, the indication for diabetes, and Wegovy for the indication for obesity. And then there's tirzepatide, which is Mounjaro for diabetes, and now just about 6 weeks ago got the approval in the form, the same exact chemical, and it's called Zepbound, but the same dose for weight loss. So if the patient is diabetic, you can, put the prescription through and hope for the best that there isn't too much of an authorization process, and hope the patient will be covered for it. Most patients with diabetes, with any type of insurance, are covered for either Ozempic.
Indefinitely, though, or does the insurance company, like a lot of things the insurance company does, say, okay, you could be on this for 2 months, but you got to, because obviously diabetes is a chronic disease. Do they, in general, not cover it for a long period of time, or it really is a case by case, I guess?
They typically cover it for a year.